in the country. Child rights organizations have raised alarm bells over the safety of children and the escalating violation of their rights. To discuss this, I am now joined by clinical psychologist Dr. Keitumetse Masego and Gugu, Xaba, who is the CEO of Save the Children South Africa. Ladies, thank you so much for joining us this morning. Alarming violence against children. We just also heard in that package now by our reporter Xaba, 3 children dying at a school on Monday, and these children were all related. Ms. Xaba, let's start with you about this crisis that we're facing. Are we unable to protect our children as a society?
Thank you very much, Masa, for the question. We strongly believe as Save the Children that we are able to protect our children. Now, there are certain things that we need to do, and we need to do them consistently for us to protect our children. It begins with just making sure that we are spending time with our children. We are teaching our children what works and what doesn't work, ways of life. And we actually need to role model it on a day-to-day basis because our children look up to us on a daily basis. And we need to teach them skills of how to live. And if they learn it from home, they become even stronger and they become protected. So as Save the Children, we strongly believe that we need parents that are ready to do good parenting, and we also need communities that are ready to contribute and make a difference in the lives of their children and ensure that their children are alive, their children are thriving, and are able to be the future transformation. Thank you.
Dr. Masego, just looking at the statistics and just hearing what Ms. Xaba has also had to say, you know, the role of parents as well, what do you think some of the concerns are when it comes to protecting the rights of children?
Thank you for having me. It's very sad, you know, what's happening to children all over South Africa because it's a reflection of what's happening in the home, what's happening in society. And sadly, you know, they become the victims of sometimes the chaos that we find ourselves in, whereby, you know, parents are unable to parent the way they will ideally should be parenting due to many factors that are happening, you know, personal stresses and even the societal stresses, but also government and society are unable to truly be there for, you know, the most vulnerable, which happens to be the children. And, you know, that's why now we're seeing what's happening. And it really is very sad to see, you know, such instances happening so often in our society. We really have a crisis at hand that we need to address as soon as possible. You know, and it's a systemic problem whereby everyone needs to be involved in addressing this problem. And I think we need to really prioritize it as a crisis.
Yeah, because it just seems that every week now there's some sort of a burial of sort for children. Last week we also saw those children who had died in that scholar transport as well, and that's also not the first. But when we're looking at statistics that tell us that on average 33 children are violently attacked each day in South Africa, and of the 33, 3 will not survive, which means that every single day in this country, there are children who are dying. So it's clearly a crisis, and we all have acknowledged that. But for you, Ms. Xaba, who's not coming to the party? Who's not doing what they can? Dr. Masego just mentioned that sometimes parents aren't able to parent the way they would like to parent ideally. But in terms of the society, I just also mentioned the scholar transport accidents, for instance. Who else should be coming to the party?
Thank you for the question, Masa. Masa, children are born from parents, which means always in the care of a child, there's an adult who needs to be responsible. So now it means we are not seeing responsible parents taking care of children. In the case of the accident, we had an adult who did not care who was in front of them and unfortunately hit a car that was full of children, which means there was some level of irresponsibility on one adult. So in a home setting again, we need parents, as I said. And when we say parents should be responsive, parents should be observing the child's demeanor. Just the way the child is talking, the way the child is looking at you, the way the child is walking. It's important that you observe that, because there could be a message that the child has not said. Also, just sitting and talking to the child is likely to relate what they saw or what is happening to them, so that you can be able to guide them on how to deal with that particular problem. It's very unfortunate that we're hearing about poisoning that has been given to children. There is an adult that is involved, because children at times do not know what is poison and how did that poison get into the children's food or whatever it is that they were eating. So there is a need for all adults to realize that the message that the violence that we are seeing on children is indicating that the violence is occurring in us, and we are transferring the violence to our children. So everybody that we are educating about prioritizing reduction of violence should be in the lookout and check how they are physically, emotionally, and otherwise reducing violence. Thank you.
And Ms. Xaba, in the case of South Africa, we do know that there are plenty child-headed households, for instance, so there won't be that adult who's going to be there to be able to assess and monitor behavior that may be changing. What is the role of the Department of Social Development here? Shouldn't they also be monitoring that children are growing up in an environment that is conducive for them and, most importantly, that is safe for them?
Thank you for that question. When we say everybody, we are talking about the child themselves, we're talking about their family members, we're talking about communities that are around that child, we're talking about government structures and civil society organizations that are around. We all have a responsibility to ensure that if it's a child-headed household, what services are we providing that are creating a system that will reduce violence for that particular household? And how are we supporting them? How are we monitoring that they are getting the services and also, the interventions that they need? For instance, in a child-headed household, already you need to support the children so that they understand how they can cope in the environment they are in. And then there's constant support that must come from social development and civil society. Most of our communities have civil society that is active. And then what is being done in such a situation? Thank you.
Dr. Masego, would it be fair to say and categorize us as a violent nation when we look at some of these statistics? For instance, that more than half, 56% of children aged between 10 and 17 have experienced physical abuse in South Africa, and 35% have experienced emotional abuse, and 9% were sexually assaulted. And these are all children, of course, between the ages of 10 and 17.
Definitely, we are really, manifesting that we are a violent society, especially when we're putting the most vulnerable at risk and the most innocent at risk, such as children. And it's really indicative of, just the mindset of the adults in South Africa, and, not taking for granted that, there's always exceptions to the rule. But because of the statistics, it's really evident that the adults themselves are not doing okay. Therefore, and they're not seeking the help to ensure that they process whatever they need to process. Remember, whatever it is that we go through as adults, if we do not process that, we'll project it onto the children. And we become like soldiers, we're on autopilot, and we exist so far removed from our emotions. It's almost like we don't have a conscious as we're existing. And who are the victims of this, adult with, who are so removed from their emotions, who are on autopilot, who are not present for themselves, never mind the children they're meant to be taken care of. Then the children are the ones who fall victim to these adults who are not doing okay.